Apple cider vinegar. You've seen it everywhere, right? It's all over the wellness world, talked about like it's some kind of miracle cure you can just whip up in your own kitchen. But how much of that is real and how much is just hype? Let's get into it.
And this quote, wow, it just nails the vibe, doesn't it? This is how people talk about ACV. It's not just a salad dressing. It's seen as this powerful, must-have homemade health tool. But where did that idea even come from?
To really get the hype, you have to go way, way back. See, vinegar isn't some new fad. It's ancient, and it has a pretty wild history.
I mean, just look at this timeline. We're talking 5000 BC. The Babylonians are using it to preserve food. You've got Hippocrates, the father of medicine, using it on wounds. And then you get into the legendary stuff. Hannibal supposedly using it to melt boulders to get his army through the Alps, and Cleopatra dissolving pearls in it for a love potion. So yeah, this deep, almost mythical history is what builds this idea of a timeless folk remedy.
Flash forward to today, and that same story is still going, just with the modern do-it-yourself twist. It's the ultimate health hack, right? The promise is that for just a couple of bucks, you can brew this amazing health tonic right on your kitchen counter.
Okay, so that's the story, that's the hype. But here's the million-dollar question. Does the actual scientific evidence back any of this up? Let's find out.
And you know what? We're going to start with the most important thing first, safety. Because before anyone even thinks about using ACV as a health thing, there are some really serious risks you need to know about.
First up, and this is a big one, potassium. See, ACV can actually lower your body's potassium levels. Now, if you're taking certain medications, things like diuretics, some heart meds, or even certain herbal laxatives, mixing them with ACV can be a really bad idea. That combination can lead to a condition called hypokalemia.
And let me be clear, hypokalemia is no joke. It's when your potassium drops to a dangerously low level. We're talking symptoms that start with fatigue and cramping, but can get as serious as heart palpitations or even paralysis. This is a legitimate medical emergency.
All right, red flag number 2, blood sugar. We know that ACV can lower blood sugar. So if you're already on meds for diabetes, like metformin, insulin, or even those newer ones like Ozempic, and then you add ACV on top of that, your blood sugar could totally crash. That's called hypoglycemia, and it's also really dangerous. Okay, so we've covered the big safety warnings. Now let's get into what the actual research has found. And honestly, some of this stuff is pretty surprising. It really goes against some of the most popular claims out there. Let's tackle a huge claim you see all over the internet, using ACV in baths or soaks to help with skin conditions like eczema. The idea is that it helps restore the skin's natural barrier. Well, a study in 2019 decided to put that to the test. They had people soak one arm in diluted ACV and the other in just plain water for 2 weeks. As you can see right here on the table, neither one actually did anything for the skin barrier. But the ACV arm, well, that came with a little something extra. And this quote from the study just lays it all out, plain and simple. Not only did the ACV soaks not help, they actually caused skin irritation in almost 73% of the people who tried it. So instead of soothing the skin, the science says it can actually make it worse. Now let's look at another really specific group. Some people with type 1 diabetes have a condition called gastroparesis. It just means their stomach empties food much more slowly than it should. So, a study looked at what happens when these exact patients have some ACV, and wow, the results were pretty dramatic. This chart shows you how fast the stomach empties. That bar on the left is the normal rate after a meal, about 27%. But look at the bar on the right. When they added ACV, that rate plummeted down to just 17%. Okay, so what's the big deal? Well, if your digestion is already slow, slowing it down even more is a huge problem. It makes trying to control your blood sugar a total guessing game, and it can make the awful symptoms of gastroparesis even worse. But okay, it's not all doom and gloom. The science isn't totally against ACV. There are a couple of areas where research shows it might actually have some real, measurable benefits. The biggest, most well-supported benefit is something called an anti-glycemic effect. Fancy term, right? All it means is that it can help reduce that big spike in blood sugar you get after eating a meal, especially one with a lot of carbs. And we're not talking about a tiny little dip here. One study, for example, found that when people had vinegar with their meal, that blood sugar spike was reduced by over 30%. That's a really significant number. And of course, the big one, weight loss. What's the deal there? Well, there is some evidence that ACV might help a little bit with modest weight loss, maybe by making you feel fuller. But, and this is a big but, scientists are all pretty clear that we need a lot more long-term research before we can say anything for sure.
All right, so we've been on a bit of a journey here, from ancient history to modern hype to some serious red flags and a few bright spots. So what's the final verdict?
This table just puts it all side by side, and it's so clear. The hype says it's this harmless, ancient cure-all. The reality? It's a potent substance that has real effects on your body. The hype says it soothes skin. Reality is it can cause irritation. It's sold as an easy weight loss trick, but the reality is the effects seem small and need more study. And the most important one, the hype says it's great for everybody, but the reality is it can be downright dangerous if you're on certain medications.
So look, if there is just one thing you remember from all of this, please let it be this. Apple cider vinegar is not a harmless folk remedy. It has real, powerful effects. That's why it is so important to talk to your doctor or pharmacist before you even think about using it, especially if you have any kind of health condition or take any medication at all.
And that really leaves us with one final thought, doesn't it? ACV is just one trend. There's going to be another one next month and another one after that. So the next time you hear about a new miracle supplement or health hack, what are the questions you should be asking yourself to figure out what's real and what's just hype?